That swelling can be due to allergy. So dust, dust mites, pet dander can cause the inside of the nose to swell and be congested. So nasal congestion, or what we call nasal obstruction, is very common. There are some signs and symptoms that we think are more alarming than others. So if it's a sudden change in the way your breathing is, especially if it's one-sided and it's persistent and doesn't go away, that really needs to be evaluated by your ENT surgeon, because we want to rule out some sort of growth, a polyp, things that maybe are not as common that would cause only one side to be different than the other, especially if it's associated with any bleeding or intermittent bleeding. Otherwise, commonly nasal congestion is often, or obstruction is often due to swelling inside the nose. That swelling can be due to allergy. So dust, dust mites, pet dander can cause the inside of the nose to swell and be congested. That's a common cause. And then there are anatomical things that are inside the nose, the way it's made, structural changes. So some patients have a deviated septum, and I'm sure it's a common term that everybody uses, but your septum is what separates the left and right side of your nose. And not everybody is born with a septum that's straight in the middle. So if your septum is deviated or pushed over to one side of the nose, it's going to result in airflow to that side being a lot more compromised than the other. So certain things like that can be repaired. Sometimes patients can have chronic polyps, or these are allergic or chronic inflammatory polyps, which are soft tissue growths in the nose that can be, found out by a good examination. So besides allergy, polyps, or structural changes, sometimes it's something fairly transient, and that would be an infection. So if you have a sudden increase in the amount of mucus that's generated in your nose, it's discolored, and you have some pressure in your face, facial pressure, sinus pressure that doesn't go away, that's going to be a common symptom of a sinus infection. And a sinus infection is going to cause a lot of swelling in your nose, a lot of increased mucus production, and you're not going to breathe out of your nose very well. Also, if you're not really breathing out of your nose well, you're not going to smell well. And so oftentimes when we're sick, when we have a cold, a virus, or flu, our sense of smell decreases also. If you have symptoms that don't go away after 7 to 10 days, get looked at, and you may have a sinus infection that needs to be treated with an antibiotic.